Hello, I'm here today with Dr. Douglas Lord. So nice to see you again. How are you? Yeah, Dr. Lord and I have met several times at the anti-aging medical conferences. One of the things I always admire at the doctors that I meet at A4M and ACAM is that you're still learning, you're still sharing ideas, and there's a lack of ego at these conferences that I'm aware of anyway. Maybe you don't agree.
I think that once you stop learning, you start to die.
I so agree, and that's what I admire about this. So you are a qualified MD. You were at Loma Linda University Medical School, which is probably one of the most cutting edge and prestigious medical schools in the country, I think. And you've chosen to go in this direction. What made you choose to go functional?
Well, it's very interesting. I've always been interested in more of a holistic approach. And even when I was a gynecologist, my mother always told me to be a leader, not a follower, think for myself, and don't just buy everything that comes down the road. And so when I got out of medicine and residency and started an OBGYN practice, I started really looking at more of the psychological aspect of patients and how to be more holistic. And as much as 30 years ago, I had an acupuncture, massage, and a psychologist in my office, in my gynecologic office.
And 30 years ago, acupuncture would be considered sort of out there.
Yes, it was. And some people thought I was a little crazy, but I was getting great results and I loved it. But I had a huge practice, and the thing that really started changing everything for me was when the Women's Health Initiative came out in 2002, and I said, my gosh, they've been taught to give Prem-Pro, and this is bad stuff. I can't keep doing that for women. I've got to learn something else. And I started really looking into this. I read John Lee's book about 25 years ago on progesterone and said, I'm not giving Provera anymore. And then Dr. Patty, who is a big name in this area,
brilliant woman. Yeah.
She used to work for me in my gynecologic office. You probably didn't know that.
I didn't know that.
And I actually started introducing her to some of this stuff. And then she left after she did this long stint with Bill Gates for a couple of years, running a program in Africa and Asia. And then she started studying integrative medicine, and she called me up and said, Doug, get down here and see what I'm doing. And so all the things started fitting together because I was not willing to use Prem-Pro anymore, and I was looking for something better, and I knew women needed something. So I started studying with her, and I went to A4M and took the fellowship in hormones and so forth and so on. And I started switching my whole practice. I stopped OB, then I finally stopped. I stopped doing surgery. I was doing hormones for women. Then I started adding hormones for men in my OBGYN office, which was really sort of interesting. And then Nava came along, and it was the perfect fit for me. And I said, there's no way in the world I can retire now. I have to do this. It's just too exciting.
And for those who are watching this who don't know what Nava is, can you explain Nava?
Yeah, Nava is we have it called Nava Health and Vitality Center. We have, at the present time, we started about 3 years and a couple months ago, and every center we have the complete complement. We have nutritionists, we have acupuncture, we have massage, we have chiropractic, we have doctors, we have nurse practitioners. We have a hyperbaric chamber in every center, and it's a very holistic approach. And what we do is we do a little bit different than traditional medicine when we do a history. And the first visit when we do it is about a 30-minute visit, and we ask a lot of questions about your hormones. We ask questions about your thyroid. We ask questions about your adrenal. It's not just a review of systems. What surgery did you have? And then on the second visit, we get blood work at that time, a lot more than what traditional medicine would do. And then on the second visit, you spend about 45 minutes to an hour with a physician, and we go over all of what we've learned, and we take everything and put it into what we call a custom vitality plan for each individual, looking at their blood work, looking at their goals, looking at their history, And we put as much emphasis on the history as we do actually the blood work. It's not just the blood work, because as you know, there may be people in what is considered a normal range that may not be normal for them, and they may need treatment. So, and then after we develop that second visit with the custom vitality plan, then we start working at the areas that they want to get them to try to balance everything in their body and reach as much as 100% as they can possibly be.
So what you're offering is a new way to be healthy and a new way to age.
Well, I think, holistic medicine has done some of this. We have everything at each center, and our whole concept is trying to balance the entire body as much as we can to get it working most efficiently.
So when you talk about balance, the first thing I think about is the gut. And pretty much everybody that I run into has got some gut issue. They're bloated, or they're constipated, or they unexplained weight gain, or they just don't know why they don't feel well. When someone comes in with that complaint, where do you start?
Well, we believe the gut is your other brain, and I'm sure you can relate to that. Mm-hmm. And the bottom line is, if it's gut, we look at food sensitivities, we look at all of the things that they're doing, and then we develop a plan. We have a gut cleanse plan that takes 3 months, and it uses supplements and dietary changes. We've read a lot of stuff with Perlmutter, and I'm sure you're very familiar with him. And one of the things that I think is very exciting and is just almost unrecognized by the majority of people in medicine is that the gut and the brain are so intertwined that they work together. And if you don't fix the gut, you can't fix the brain as well. So that's really, really an important part of what we do.
I think that it's so crucial because everyone's wondering where Alzheimer's comes from. And, I'm just over here on a couch thinking about it. If you've got a toxic body and you've got leaky gut and all the toxins are leaking out into the bloodstream and they're looking for fatty organs and the brain is the fattiest, and the toxins get up in the brain, and then the hypothalamus and the brain shrinks to make room for more toxins. Sure seems to me like maybe all disease, including brain diseases, Alzheimer's, most likely starts with gut imbalance.
Well, it's
am I off or?
No, I think that, I heard Dr. Perlmutter speak, and he gave a really good talk about this, and the two of the biggest problems with brain health or too much sugar in the gut and too much inflammation in the gut, which can be caused by dairy, a sensitivity to dairy or a sensitivity to gluten. But there's also other foods that can be. But the two biggest problems in our society is the casein in the dairy, the protein in the dairy, and also the gluten. And then with the GMOs, what's really interesting is that don't seem to be native to our gut. That can create a lot of problems also. And so gut health is absolutely critical, and that's why we have nutritionists at every center. So we do weight loss, but we also do gut health and get inflammation. Inflammation is like the cause of 70 to 80% of all our diseases. And so if we don't work with inflammation, we're not going to get the brain healthy, that's for sure, or the rest of the body. The other thing
yes, go on.
The other thing that's very interesting is a book by Dr. Friedman. You may have seen it, How to Cut Your Risk for Breast Cancer, Prostate Cancer, and Alzheimer's. And on page 133, it shows all of the things that increase with Alzheimer's, like or decrease or whatever. And when you look at what testosterone does to the brain, it does exactly the opposite. We find it's one of the most brain protective things you can do. So a combination of gut health and balancing the hormones, particularly testosterone, can make such a huge difference.
Mm-hmm. Dr. Abraham Morgentaler out of
Harvard. Absolutely. He's many times.
Yes, I'm sure. And when I was writing one of my books, I think it was Breakthrough or Bombshell, and he said, I just completed a small but very important study that men who came in with elevated PSA or prostate cancer, it didn't matter what stage, in every single case, when I gave them testosterone according to their deficiency, their PSA went down and their cancer went into remission. And I had remembered talking to Dr. Terry Hertog, who's over in Belgium, and he said the same thing, that in Europe they treat prostate cancer with testosterone. So it seems to me that a hormonally balanced body is what is required for optimal health. So when people come in, do you completely do a hormone panel to see where all the levels are?
We do a complete hormone panel, and we look at all of that, and then we try to correct whatever women's hormones can start getting out of balance in their 30s, and especially in their 40s. I mean, the testosterone is one of the first things to go. Then the progesterone starts to go. And one of the things we see with progesterone is, beside the PMS, the other thing that happens, anxiety increases, and it can even have panic attacks, which are related to the hormone imbalance. But most of my OBGYN colleagues don't understand anything about that, because the drug companies want you to just give birth control pills to everybody. Right. And it shuts down the ovary. And when it shuts down the ovary, you get no testosterone, and you're getting synthetic estrogen and progesterone, and then the SHBG, sex hormone binding globulin, goes up, and it really messes everything up. And so we try to look at it from the early 30s, or sometimes even in the 20s, people are progesterone deficient, and then add what we need to balance whatever it is to get all the hormones in balance. And when we do hormones, you have to look at the adrenals, and you have to look at the thyroid, because they all work together.
They sure do. I know I had some stress last summer from a job I was on, and I am very hormonally balanced because, I've worked on it for so long. When my thyroid got off, I had heart palpitations when I was sleeping. I couldn't sleep. My hair took a hit. My hair got frizzy and it cut off to about right here. My nails turned to powder. And you realize what you're saying is that hormones are a symphony, and they all work together. And when one's off, they're all off, right?
That's exactly like what I say.
Is that how you say it?
Like an orchestra. And if the string section isn't working, the whole orchestra doesn't work very well. And each part of that is really important. And so when we look at the hormones, we look at all of them and then try to balance everything as much as we possibly can. And most of the time we can do it very well. And
everything you're saying makes it appeals to my common sense. And I think that's how I got interested in all of that. Like, who thought it was a good idea to spray poison in our food in the first place? And how can, Dr. Russell Blaylock, he said to me, in today's world, he said, it's like, depending on our exposure, we get anywhere from a quarter of a teaspoon to, let's say, a teaspoon of, let's say, rat poison every day. How long do you think you can stay healthy taking any amount of rat poison? So we're living in a very unhealthy environment, and to do it the way we used to do it just can't possibly work anymore, which is why I applaud doctors such as yourself who are doing this. So
the gut has got to be healthy, and if we're assaulting it constantly, it's hard for it to stay healthy.
Right.
And so many of the things with the preservatives and the box foods and all of the other stuff, but it's also, I think, really important. We have so many patients coming in who have been treated by traditional medicine with gut health problems, but they don't even look at what might be the problem from a food point of view. So we do a lot of food testing to find out what the sensitivities or allergies are, so that we can start eliminating them and then come up with and a lot of people, as you know, I've heard you talk about this, seen it in your books, have a yeast overgrowth. And until you get that yeast out of there, that's really important, because the gut's not going to be healthy if it's full of yeast.
In my 20s, I used to get a lot of yeast infections, and it was treated always with antibiotics. And when I think about the merry-go-round I was once on, I take an antibiotic, nobody told me about probiotics, then it kills it off for a couple of weeks, then it comes back again. It was this chronic thing, and so many women are treated that way. Tell me about your feeling about the importance of probiotics.
Probiotics are absolutely necessary. We recommend probiotics for everyone that walks through the door. I mean, the microbiome, which is the bacteria in your bowel, is very interesting. That traditional medicine is starting to recognize this a little bit. I just read an article out of Johns Hopkins about the microbiome. And one of the things that I think is fascinating, the relationship between your gut and your brain. And I read an article not long ago where they said that they're going to have to change the anatomy books because they've now found with some of the new technology, there is a physical connection between the gut and the brain. And we talk about the gut being your second brain. Mm. So I mean, that's so really important to get the right kind of bacteria. I mean, in some medicine, what they're doing now, which I think there's much better way to do it, is they're actually doing a colonoscopy on healthy patients to get their bacteria and then put it in a sick patient.
Is that called fecal transplant?
Fecal transplant, exactly.
I've heard a lot about that, and everything I've heard about that has been highly positive.
Yeah, it works, but it would seem better if you don't have to get to that point.
Yeah, right. Right. And also if it had a different name. The name is clever.
I totally agree with that.
I know the first doctor that...
What they're doing is they're taking somebody with bad bacteria and putting good bacteria in, and it changes immediately.
Interesting. Now, are all probiotics created equal?
Of course not. I mean, there's some total garbage on the market, and there's some really good stuff. And the problem is the FDA does not control it, and we don't want them to. They're trying to control everything, but we don't want them to because you couldn't afford to buy them if they controlled everything. Right. So it's really important to try to find out. And what we do at our center, everything that we sell has been batch tested by an independent laboratory to know what it is. You've probably seen the article in the LA Times some years back where they tested about 10 different products, and they found that they had from 0 to 300% of what was on the label. And the FDA just did a test on the GNC and Walgreens on ginkgo biloba and 2 other, and they found 0 ginkgo biloba in any one of the samples. So it's really important to buy from suppliers that actually do the batch testing to make sure you're getting what you say you are, what they say.
Do you think a good probiotic needs to be refrigerated, or are there freeze-dried that work just as well?
I think there are freeze-dried that works just as well. I mean, we use a very different probiotics, but there are some very powerful probiotics that, I mean, it's nice to refrigerate them, but I don't think they have to be. How do you feel about that?
Well, there's a brand called Ohira that you don't refrigerate. That
well, the ones that we use in our center, we don't refrigerate because it's hard to do. And
but I think people don't. What I think people don't understand is the different strains of probiotics. You need to take additional lactobacillus. Do you need to take Saccharomyces boulardii? Do you need to take, or is there one that covers all? It's confusing.
Our standard, the standard antibiotic, I mean the probiotic that we use has 13 different strands.
Ah, how nice! One pill with everything.
But we have a thing called the Nava Select Pack, and in that pack, it has a high potent. We have like 30 packets in a box. Each packet has a high potency multivitamin with K2 in it, which helps drive the calcium into the bone rather than the arteries. It has an adaptogenic herb for the adrenal glands. It has a highly sophisticated fish oil for cutting down on inflammation. It has magnesium. It has 5,000 units of vitamin D, and it has a probiotic, all of those, and that's our basic unit that we recommend for virtually everyone.
And it's all in one packet?
You get a box with 30 packets, you open one packet, and every one of those things is in each packet.
That's a beautiful thing. I lost a bet with my husband about 10 years ago, and if I lost his end of the bargain, he drives a very hard bargain, he said, all right, if I'm right and you're wrong, you have to do my vitamins for life.
Who won?
I should know better than to ever make a bet with him, because he never makes a bet that he thinks that unless he thinks he can win it. So to make it easy for people, because people get overwhelmed by taking all their supplements. But for those who say, oh, supplements, it's just expensive urine, what do you say to them?
Total garbage.
Yeah.
Total garbage. The data is clear. I mean, I started using 5,000 international units of vitamin D with all of my obstetrical patients about 10 years or 12 years ago, because when we tested them, there wasn't one single patient in over a year that had a vitamin D level that was any more than 20 or 25. And so I put every single one. Now the studies are starting to come out how valuable vitamin D is in obstetrics, and also thyroid. I mean, thyroid has been a big problem in obstetrics also, because a lot of women, their thyroids are too low, and that can make a significant difference in the end result with the baby. So,
as a former gynecologist, there's a question I'd like to ask you that I've been thinking about a lot. Our babies are now being born toxic. I'm sure you've seen that study by the Environmental Working Group that they did. They tested the cord blood of newborns over the economic spectrum, from the poorest to the richest, for 287 different toxins. Every single baby tested positive for a minimum of 180 toxins. So the babies are already born today, no matter their economics, toxic. And that means their immune systems are compromised early on. As a gynecologist, or a former gynecologist, do you think, knowing the environmental assault today, that gynecologists need to prepare the womb for getting pregnant? Like that the mother who's going to bear this child needs to have perfectly balanced flora, etc.?
Absolutely, but in our society, it's not likely to happen because of the way this thing is set up, and that we don't hardly ever get anybody who comes in for pre-pregnancy training. Most of the time, they come in after they're pregnant.
Yeah, it's true. It's those nights in the back seat of the car.
I tried to implement a program, and I did some trying to get people healthier before, but it was very hard to get them in, and they really weren't that interested. But once they got pregnant, all of a sudden they were interested.
Yeah.
So
Do you think once the woman is pregnant that then her gut can be healed even though there's a baby growing in it?
Absolutely. Absolutely.
Yeah. Okay. All right. That's hopeful.
And I mean, I would tell women 25, 30 years ago, do not drink any milk or take any dairy product while you're pregnant, because there was evidence that the offspring would have more asthma and allergies. And it was, a little skeptical at that, a lot of people skeptical, but now that's showing that's absolutely true.
Yeah. Yeah. I had my child when I was a teenager, and I always tell my son, your disadvantage was that your mother was so young. Your advantage is that I had never smoked a cigarette. I'd never had a drink of alcohol. I'd never had an antibiotic. I said, just there, you are ahead of the game.
That's true. Very good.
I want to go back to what we were talking about with vitamin D. The confusion with vitamin D3 is how much. The FDA has a cap on it that I feel is very low. I think it's 2,000 IUs. What do you think is the proper dosage of vitamin D3 daily?
Well, generally, I mean, first of all, that's insanity.
Yeah.
The FDA doesn't know what the hell they're talking about.
Thank you.
And the interesting thing is, my office, my GYN office, was directly across the street from the FDA in Silver Spring. Mm-hmm. And I had at least 3 or 4 pharmacologists from the FDA who were patients of mine. So we had some rather interesting conversations.
I bet. I would have liked to have been a fly on the wall.
Probably would have been interesting.
Yeah.
The bottom line is that it depends on what their vitamin D level is. I mean, I've had people come in whose vitamin D level is as low as 7 and 8 and 9.
And what is optimal?
Optimal is theoretically optimal is 30 to 100.
Oh, wow.
I'd like to see people at 50 or 60 as far as I'm concerned. So with somebody comes in at that, I might put them on 10,000 IUs for 3 months and then redo their vitamin D test and see where they are. But clearly everybody, I mean everybody, I've not seen anybody who can't use at least 5,000 IUs on a daily basis. And
do you think that's because we're spending so much time indoors now?
Oh, I think it's a combination. We talked to the dermatologist. You've got to use sunblock, and sunblock blocks vitamin D. So, the reality is we're not getting much vitamin D. And I tell patients, either take that or get naked in the sun 2 hours a day.
Yeah. Yeah.
Most of them say, I'll
Not
take
always,
them.
not always convenient. No, I see mothers rubbing sunblock on their babies, and I know it's well-meaning, but I think you're rubbing chemicals all over their skin, and weigh the balance there.
Well, we've gone too far, because as far as I'm concerned, if we have enough antioxidants in our body and our diet is really good, it's going to take care of our skin a lot better, and you don't need to have as much sunblock as long as you're not getting excessive exposure to the
Right.
sun rather. So I think the dermatologists are looking for the worst possible. They're looking at the worst possible nutrition. But when you have really good nutrition and your antioxidant levels are really good, you can handle a little bit more of that. Do you agree with that?
I do, and I think for a while there was just a fad, probably to sell sunblock, that you're almost made to feel guilty if you didn't slather your child with sunblock every time they walked out the front door. I being an Irish woman, when I was a little girl with my skin, because I'm supposed to be on a bluff with a bunch of sheep in a wool coat, my mother always put, I was the kid with the white nose with the zinc oxide and the white on my cheeks, and I hated it. But anyway, it wasn't toxic.
Well, it's almost interesting, also interesting, I should say, that as we get older, we can actually handle more. And the 100 was supposed to be the upper limits, but the stuff that I've read from lots of different sources is that once you get a lot significantly older, you can actually go above 100. But I know that most traditional doctors freak if you talk it anywhere near that. But I love to see people at 50 or 60. And I mean, vitamin D is critical for your immune system as well as your brain and your bones. I mean, it's absolutely critical.
The four most important systems in our body: brain, heart, endocrine, and immune, right?
Very much so, yeah.
So what are the symptoms if you're taking too much vitamin D3?
I've never seen it, but theoretically, from what I read, is that you could have a little bit of your brain gets a little bit foggy and so forth, and it's real easy to get down by giving some IVs and not give them any, and within a day or two, it's fine. But I've never really seen that ever. I've never seen anybody, and I've seen a couple of people that overdid it and were up to 110 with absolutely no side effects or symptoms whatsoever. But I always say, you don't need that much. There's no advantage to being that high. So try to get it down into the 50 range or so.
And at your clinic, do you also do IV treatments like chelation or vitamin C?
We don't do chelation, but we definitely do the Myers cocktail, and we do the glutathione and injections and so forth. So
this is all part of detoxification.
Yes, and well, we also use it. We use it for athletes prior to a performance of like runners. They will come in and have the IV nutrition, and then after the event, they'll come in and get the hyperbaric chamber to try to refresh their bodies. And we're using that with some professional athletes and also a lot of ex-professional athletes.
We must in this country reach a point where we accept functional medicine, these so-called alternative treatments, as viable, so that everybody can have access to it. Because as you speak, I feel happy for your patients that they have access to something so cutting edge and to a doctor who is so forward thinking. But so many women write me and say, I wish I could afford bioidentical hormones, or I wish I could afford your kind of medicine. So I'm hoping that's what happens in the future. And if things calm down in government, I'd like to march like Legally Blonde up to Tom Price and see what we can get going with that. Maybe you'll come with me.
Absolutely. I mean, I'm here in the Washington area, so I could be there. But the real problem, I mean, there's so many problems involved, but one of the problems is that there's nobody in the health industry that benefits from you being healthy.
Right.
And the reality of the situation is the insurance industry, it controls how we see patients. And one of the things when I went into practice in the last millennium, a long time ago, people were my patient who had insurance, and we could do whatever we wanted for them, and the insurance then would pay for it. Now the insurance companies have been able to reverse that so that they're their patients, and they'll let them see me if I do what they tell me to do, which is just incredibly bad medicine.
Right.
So
Right.
one of the problems is that people that do integrative medicine, when you spend the amount of time that we spend with patients, you can't accept insurance. So that's the problem. And so unfortunately, people with some disposable income can do it and some people can't. And I feel really bad about that, but
Me too.
I don't know how.
Well, all we can do is try to change it. And also, a lot of times when I lecture to women, I say, it's better to do without the new shoes and to go spend that instead on your health. If you don't have health, you really don't have anything. Do you agree?
100%. We have patients, I mean, we have a lot of patients who are not wealthy, but they will give up a vacation once a year and say, I'm not going to have a vacation, but I want to be healthy and I'll spend that money to try to get healthier rather than have a vacation. And
Absolutely.
I really applaud that, because if that's what it takes, then that's wonderful, because if you don't have health, you're in bad shape. I mean, you know, I have a friend that's my age who's basically dying. And when I went to my medical school reunion at Loma Linda 51 years ago, I graduated. And 19 of the 86 people, 19 were dead, 20 were too sick to attend. And all of the ones that were still working were the healthiest ones. It was very interesting.
Interesting. And what do you attribute that to?
Well, I think when you stop, I attribute it to a lot of things, but I mean, when you stop learning, you start to die.
Yeah.
And if you don't feel you're valuable. I mean, one of my colleagues told me when we were playing golf not long ago, he said, I feel jealous of you. And I said, why? He said, you have plenty of money, you're living a good life, you're playing golf a lot. He said, but I don't feel like I'm valuable anymore. I'm not doing anything, and I did that my whole life. So I think when people start to not have a use for themselves, they start to go downhill. And I want to keep learning until the day I die.
Well, for those of you who are watching, listen to what he just said. This is a doctor who's turned on by real, true health. And all doctors today are not created equal, with all due respect. I so respect what you're doing. And I urge people who are watching this to look up the Nava Health and Vitality Center. Dr. Lord is in Chevy Chase, Maryland. And if you live in that area, Washington, etc., it's worth the trip.
We're in Columbia, Chevy Chase, downtown DC, and North Bethesda. We have 4 centers now.
Look at that. Lucky people. I thank you so much for this wonderful conversation. I'm so happy to have this talk with you.
I enjoyed it.
Thank you.